So
Good
nice
to meet
to
you,
see you.
James.
Hi, James.
Good to see you, Peter.
Yeah.
All right. Well, welcome everyone. It is 12 o'clock. Welcome to Lunch Without Lunch. I'm Amber Rowden, the community storyteller at Rainforest, Alberta. If you are new here, please drop a reaction in the chat or on screen. We love new people to the Rainforest. Also, please feel free to introduce yourself in the chat and share your LinkedIn or how you'd like to connect. So I'm going to start us off today with a land acknowledgement. So in the spirit of reconciliation, we acknowledge that we live, work, and play on the traditional territories of the Blackfoot Confederacy, the Siksika, the Kainai, the Piikani, the Tsuut'ina, the Stoney Nakoda Nations, the Métis Nation Region 3, and all people who make their homes in the Treaty 7 region of Southern Alberta. For those in the Edmonton area, we acknowledge the traditional lands of the Treaty 6 territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, as well as the Métis. Thank you for providing us a space to share a reconciliation and demonstrate leadership on reconciliation, and for a commitment to joining Rainforest Alberta in doing so. If you have your own land acknowledgement, please feel free to share that in the chat or connect with me directly. We're always looking for ways to share a different land acknowledgement as well. So welcome to Lunch Without Lunch. Welcome to the Rainforest. To introduce the Rainforest, we have our wonderful co-host from Edmonton, Gail Powley, who's here to share more about the Rainforest. So I'll pass it on to Gail.
Thank you, Amber. Always a pleasure to be here with you, and of course, Rainforest Elder Peter LaFontaine. So my name's Gail Powley. I'm president of Technology Alberta, an organization that supports the growth of the tech sector with our advisory board of entrepreneurs, half from Edmonton, half from Calgary. And some of our programs are our job creation program, supporting entrepreneurs to bring on some talent from either post-secondaries or Alberta residents that may be working in other sectors and want to get into the tech sector. So please feel free to go on to the Technology Alberta website and apply for some funding to help employ Albertans. So we're growing the tech sector together and collaborating with great organizations like the Rainforest, of which we volunteer for. So the Rainforest is a community of innovators, doers, dreamers, connectors, builders. We are very social media literate, thanks to Amber. So you can connect with us in all of those social ways. And also always at the Lunch Without Lunch every Wednesday at noon. And there's multiple other initiatives, but I will go on to the next page to keep us on track. The video. Thank you, Amber.
What does it take to realize an idea or for a seed to sprout? At Rainforest Alberta, we know the answer is rooted in trust. Traditionally, Albertans have cultivated their ideas in established systems. Inputs that don't fit these systems are weeded out. Opportunities for growth are missed. But now, Albertans want a dynamic landscape that can evolve organically, like a rainforest. At Rainforest Alberta, we believe a culture of trust is the fertile soil where ideas grow. Our budding innovation ecosystem is a network of relationships pulling each other up as they push forward in their own field. Trust breaks down barriers. An open, inclusive network increases collaborative innovation. Successful breakthroughs inspire new ideas. A cycle begins. Rainforest Alberta is a movement to amplify trust by cultivating honesty, inclusion, and accountability. How? Our social contract holds us accountable to demonstrate trust across the province. We meet to have honest conversations around collaboration. This leads to more inclusive spaces for everyone to fearlessly build new ideas together. By raising the standard of trust, Alberta's ideas, talent, and resources can be evergreen. Visit rainforestab.ca to sign the social contract and start growing together.
Excellent. So with that background in mind, also some more details is that the Rainforest uses 6 pillars to guide our conversations and actions, with all pillars not weighted equally. Culture is of utmost importance, followed by leadership, policy, infrastructure, resources, engaged activities, and role models. Next slide, please. our scorecard, by the way, rates ourselves on all of those areas to ensure that we are continuously improving. And it's interesting, in the toughest times, during COVID, I have seen very positive movements, including on these scorecards, showing that when you need a community, you can count on us, and it's lovely to see. So tips for making the most of lunch without lunch. Introduce yourself in the chat. Some of you are doing that already. Fantastic. Thank you for role modeling that. Let people know what you are working on, and in true rainforest fashion, paying it forward and letting people know what you need so that others from the community can offer you their insights or connections. So please share what you can give and what you need in the chat. Feel free to connect with individuals through direct messaging. Put your camera on. We want to get to know you from across the province. Ask questions. Often when we have great speakers that have been curated by Amber and the rest of the Rainforest team, often the speakers will ask for questions afterwards, but feel free to put it in the chat, and then we will bring it up to the attention of our speakers at the end of their session. And then also we encourage everyone to continue to connect via Rainforest Slack workspace and check us out on #lunchnotes. And the recordings are posted on YouTube. Anything else, Amber?
No, that's good. I can touch on this if you'd like. Okay, perfect.
That'd be great.
Thank you so much, Gail. So each week at Lunch Without Lunch, we touch on a social contract value. And this week it's team sport. So I will create teams to play, dream, experiment, iterate, and persist. I understand mistakes happen. Failing quickly and cheaply are acceptable ways of testing new ideas. So as we go forward throughout Lunch Without Lunch and the week and in our conversations, think about how you're a team sport, how someone can be a team sport to you, and just keep that social contract value in mind. So I will also put the social contract website in the chat, so you can sign that. If the 10 values resonate with you, you can sign that. And without further ado, I will introduce our wonderful speaker for the day. I apologize if I get your last name wrong, Kerri. Please correct me.
It's all good. It's Oshust.
Oshust. Awesome. All right. So Kerri Oshust is the director of the Center for Advanced Medical Simulation. She has previously worked as an MRI and MRT in Edmonton and holds an MBA. Kerri is a strong believer in the essential and transformative nature of clinic simulation to improve patient safety and care, not only through the education of the next generation of health professionals, but also by supporting local SMEs and innovators in developing new health technology. She has a broader vision of collaboration between all the support structures across Alberta to help lift the entire ecosystem. It's very great to meet you, Kerri, and we're very excited to have you here. So I'll pass it on to you to share your story.
Great. Thank you. I'm just going to share my PowerPoint, and I love that it's the team sport because that is what we are about in healthcare. So I'm very excited to be presenting today.
I love when that aligns. That's awesome.
It aligns so well. So that's great. Great. Can you see my PowerPoint? Everything looks okay?
Yes, we can.
Looks great.
Great. Great. So hello. Thank you. Thank you for the nice introduction. My name is Kerri Oshust, as Amber mentioned, and I am the director for the Center for Advanced Medical Simulation, also known as CAMS. And I'm joined here today by one of my colleagues, Ephraim Violato, who is a research associate with CAMS as well. So just a quick show of hands. Has anybody heard of clinical simulation or healthcare simulation previously? I see one hand. If you can, couple, great, perfect. So a couple, so that's great. So at NAIT, the School of Health and Life Sciences, we have 3 pillars. So we have education, innovation, and research. And just to give some context around the center and simulation more generally, I'll be talking a little bit about the education side first, And then this will really help to see the value of how we can use simulation over to support healthcare innovators. Does anybody know where simulation originated from, which industry? It is fairly new in healthcare. Even we can pop it in the chat if anyone.
Military.
Military, yes, they are a big user.
Energy?
Energy is one as well. Aerospace, right? Aviation was actually the first initial users of simulation. So healthcare actually models after the aviation field. But of course, many big users now, and especially military being one of them. So what do we do? So most simply is CAMS really create scenarios in a realistic clinical, community care, and home care environments. So with over 6,000 square feet of our immersive space, we can create simulations that range from pre-hospital settings to an operating room, which you can see here, as well as home care scenarios and everything in between. So you can see we actually have set up in one of our immersive theaters, it's actually a bar scene to help our students work with a bar fight. So we really look at how can we integrate what is being done in the real world in a simulated environment. So in addition to we have our 9 theaters and control rooms, we have an extended reality theater, as well as a driving simulator and a fully functioning ambulance box as well. So most importantly is CAM simulation space provides a safe environment for learning and experimenting. It is one of only 3 centers in Canada that's internationally accredited. And we are also a CAE Healthcare Center of Excellence. And CAE is a global leader, not only in the aviation space, but in the healthcare simulation space as well. So essentially, we do have the credentials to assure users that we are using the best practices and of course, maintaining transparency. Yes, the bar scene is a particular favorite. I see on the chat that it's cool. So everyone likes these different raves and bar scenes. So about clinical stimulation, so it really creates, again, that safe, realistic environment to support students in their learning journey and innovators in their product development journey. So realism is achieved in many different ways. So we can use through the clinical, we use identical equipment that we would see in the clinical setting. We have actors, or we call them standardized patients. You can see here, we use something called moulage, which is, oops, and I think I accidentally moved my screen. So you can see the moulage. So it's able to recreate any type of medical condition with makeup. And we also enhance realism, again, through our 360 extended reality theater. So in this image, you can actually see our students working in a scene that's set to be the Edmonton River Valley in a medical emergency. There we go. I just have a little bit of delay on my computer. So since the establishment of CAMS in 2016, we've become world leaders in simulation. We have over 30,000 hours of simulation conducted to date. And really in North America, and this is why I loved that team sport first pillar that we talked about, is that we really operate on a model of patient-centered care. But with that, there's often a complexity of our health system, and the patient part of the model can be forgotten. And that's why patient safety and patient outcomes is really the critical piece of what we do at CAMS, whether it's supporting students or working with innovators. So healthcare is really a team sport, and the patient is an essential member of that team. So what is simulation education used for? It's used to improve performance and optimally prepare students. So it brings together both integrated skills of knowledge of the classroom and labs, and then puts it into that safe clinical environment. And it is a place that it is okay to make mistakes. So I heard Amber allude to this earlier. Where you want to make mistakes, it's in simulation where it's safe. So in the past, we used to have this saying, see one, do one, teach one. Now it's see one, do hundreds, and then go on to that clinical practice. So this makes our students better practitioner. As Amber mentioned in my bio, I did work frontline healthcare, and I won't tell you the date or how long, but when I trained, even something a skill like learning IV, how to insert an IV, we learned in the classroom. We took oranges home, we practiced on an orange, and then the first time we ever did it was actually on a live patient in a hospital. So there was this really big gap. So we've come a long way, and it's really making our students better practitioners. So not only is simulation used for those technical skills and procedures, but it's also for students to practice those interpersonal skills, how to interact with patients, as well as other healthcare practitioners. While previously overlooked, the need for that listening and that trust, it's really become an essential aspect of care. So simulation can also be used to assess competency. So a place where students can be assessed and evaluated to ensure that they are competent and, before moving to that practice. So what simulations, or what type of situations are trained in simulations? So we're really looking for those situations that are either unique or impactful. This can involve end-of-life care, dealing with conflict, or providing support for concerned family members or patients. So what is the value, or what can CAMS really bring as valuable? So we have both tangible resources, so the center itself and all of the equipment, but we also have those intangible resources such as the knowledge and the human talent. So two of our biggest assets that we can provide to multiple groups are those tangible and intangible. So we have health programs at NAIT strive to really be leaders in that education. CAMS provides the resources to build that most complete and integrative curriculum as possible. We have instructors, so the instructors within the school are also healthcare practitioners, and they're really dedicated to that student learning. And our staff in the simulation center are simulation experts that really help those students. So we have expertise in that area. Of course, we're always looking to conduct research to improve healthcare and education beyond the walls, and also becoming more and more active in conducting and supporting research with our obvious focus on simulation. And then, of course, the students, most importantly, is to add providing value to our students, giving them the best of educational experience. And then we're always looking to increase that value. So what does that mean? Is that we're here and we've identified more ways that we can just support education, but we can also help support that innovation. Of course, modeling after that aviation industry, that we can support innovation within the health system and ultimately improve that patient care. So I'm sure many of you have seen this diagram a little before in the past. So what we know is health innovation is extremely challenging. We know accessing the necessary environments is challenging, and accessing end users to help uncover problems, discover opportunities, and really learn about that end user behavior to advance the design and the development of the product can be very difficult. So with that, it really creates the gap in the product development journey between conceptualizing and scaling. So what we really hope to add value, or CAMS can add value, is by helping companies bridge that gap from committing to scaling to help avoid, that valley of death, and really trying to focus on getting our airplanes straight across to scaling instead of dropping off and then not being able to proceed. So really looking at it, CAMS adds value to the ecosystem by bringing new infrastructure to the landscape to bridge that gap at earlier stage testing. And this helps to reduce a major bottleneck in adoption. And this bridge is built by our knowledge and our expertise in clinical simulation that we've accrued over many years as leaders in simulation education. And we provide access to clinical environments and end users to help SMEs iterate on their design and move along that development journey faster and more successfully. So at NAIT, within the School of Health, we have a culture that values innovation and a goal of improving the province through innovation, particularly in healthcare. So as mentioned, we identified the opportunity for CAMS to add value. So we applied for and received the Alberta Innovates grant through the Health Innovation Partnership Platform to really help us contribute to strengthen the health ecosystem in the province, thus driving jobs and new business and thriving economy by providing industry access to CAM's state-of-the-art facility. So we've worked with and partnered with numerous SMEs, such as Mach 32, NAIT Labs, as well as MMEs like CAE Healthcare, as I previously mentioned. The photo here shows two different scenarios that we tested for Mach 32 with two different prototypes. And one was using respiratory therapists as end users, and one was advanced care paramedics. So one you can see is a hospital scene, and the other was actually a car accident that our paramedics would use the device. So NAIT Labs, which isn't pictured here, we also developed a custom home care setting, and they found that simulation was incredibly valuable for the prototype design and actually helped them speed up that prototype design. So in all cases, SMEs leave with really valuable information and insight into the direction and the design of the product. Just going to play a quick video. Sometimes it's better to actually observe the simulations here. So it's a quick 4-minute video. Oh. Sorry, is the sound not working on that?
No sound. I know that Ross would tell us how to share the sound.
I thought I shared it earlier. My apologies.
It's before you pick share, you have to pick, there's a little button in the bottom left corner that you have to click that says activate the sound.
I'm going to stop sharing for just 2 seconds then.
Yeah, and as you go into share.
Okay, gotcha.
See a little button? Yeah.
I do. Thank you.
You're welcome.
Go.
Who needs Ross? Hey.
Well done, Peter.
Let's try this. Let me know.
Yeah, but Ross taught him all he needs to know.
Come on. Sorry. Go ahead.
Okay.
He's trainable though.
Makeup to imitate the realistic injuries
Yeah, old dog new tricks.
To increase the realism of the scenario for the student. Here, students from NAIT's Medical Resonance Technologies program are setting up a C-arm in an operating room environment. We have actors playing the roles of the surgeon, anaesthetist, and scrub nurse. An animal health student is responding to an emergency in our waiting room. Here we have set up a portable audiovisual system with the same capabilities as our simulation theatres. This is footage from one of the companies that we worked in phase 1 of the HIT project, Mach 32. Here you can see 2 paramedics responding to a patient involved in a car crash. During their treatment, they were using Mach 32's auto-injector. They will later take part in an interview where they discuss their experience using the device in a clinical setting. Here you can see a respiratory therapist explaining the MedRoad application developed by another HIT project phase 1 company, NAIT Labs, to an actor playing the role of a patient in a living room environment. Here is another Mach 32 product, an aerosol containment tent, being set up by one of our respiratory therapists. Once set up, they will intubate the mannequin and provide feedback on both the setup procedure and the use of the product in a realistic clinical environment. Here are some of our respiratory therapist students attending to a neonatal patient in an intensive care environment. The mannequin you see here is another high-fidelity mannequin with the ability to breathe, has pulses, and produce a variety of sound effects. Here at CAMS we have a wide variety of high-fidelity mannequins, ranging from neonatal, newborn, 1-year-old, 5-year-olds, all the way to both male and female adults. Here are some of our primary care paramedic students attending to a patient in a rave in our 360-degree extended reality theatre. As you can see, the fog and lighting adds to the difficulty of working in this kind of environment. Here are a couple of our respiratory therapists performing beta testing on a variety of simulated medical devices, such as a defibrillator, a ventilator, and an anaesthetic gas machine. CAMS was approached by CAE and asked to provide feedback on the products they called SimEquip. Here are advanced care paramedic students attending to a patient played here by one of our high-fidelity mannequins in the back of our ambulance simulator. You can see how the cramped environment adds to the realism of the simulation for these paramedic students. Here is footage from one of the scenes in our extended reality theatre of a helicopter landing. We also utilised the large industrial fans to replicate the effects of the propeller blades. This scene was filmed in association and utilised by the Canadian Armed Forces. We also have access to a wide variety of diagnostic imaging laboratories and equipment, such as a CT machine, sonography machines, and X-ray machines. As well, we have access to our vast respiratory therapy laboratories, with a large number of fully functioning head walls and respiratory equipment. Finally, we have the ability to produce high-quality interactive virtual simulations in-house. The students interact with the program to gain information and put together a picture of what's going on in the scene and make decisions on the next steps and treatment plans for the patient.
Great. And thank you for the technical help on that one. So really looking at who do we work with? What does that look like? We work with innovators kind of in that validation phase, and we're looking at a TR level of, let's say, a 4 to 6, but it's quite a soft range. So we're looking at those that have a working prototype that requires some type of clinical formability testing or feasibility. So the SME essentially is ready to put that device in the hands of users in a realistic setting to gain feedback without kind of being at the stage where they're actually ready for the testing authorization to bring it into that real world. So we're really looking at that formability, usability testing, which CAMS is really uniquely positioned to do that. We do have other capabilities, and that's why we say our TR levels are a soft, because we can also provide focus groups, maybe if you're a little bit earlier stages, or help with instructions for use, or other services such as marketing or any type of product testing as well. So what we offer is customization. So with our expansive expertise at CAMS, we can design the scenario that meets that innovator's needs. Again, with our expertise and our hours that we've completed, as well as being accredited, the expertise comes from our staff who are also registered simulation experts with healthcare backgrounds. And CAMS has 19 allied health professions that really help us bring that realism to our center. So we've also had thousands of other health professions and end user access our center as well. And that helps ensure that our innovators are key to what's happening at NAIT in that area. So with our simulation expertise, we really see it as a partnership with our SMEs. So we want to work together to understand the needs and then work together through that execution that's focusing on that togetherness and really being connected into that health innovation ecosystem. And we have many other partnerships with other organizations such as W21C and STATE as well. So how do we work together? So we start with a discovery phase to really align what the SMA needs. We customize that experience that you require for the product testing, and we work through the planning and that consultation phase. And the day of the simulation, you'll be guided by a team of experts. You will also be provided with a video recording. We have streaming capabilities, and this is really important to be provided that recording so you have access to the raw data so that you can continuously review it to help with your product design. So the time frame from discovery to completion can vary depending on SME needs. However, we're really looking at probably a lead time of 4 to 6 weeks. So with access to CAMS is we maintain a strict confidentiality and privacy, and it's really built into our process. We don't retain any type of IP. So that's a question that we're frequently asked. So we retain no IP. And we're really looking at a customizable solution for you. So the pricing is customized as well. There are no pre-packages or pre-plans. We really heard from our SMEs from when we started with a phase 1 grant that they're really looking for what they require, and that's what they want to pay for. So we're looking at a lower end of the 3,000 to kind of a higher fidelity of that 10 to 12, just depending on what the needs are. So with that, I really thank you for your time and allowing me to present today. At this time, we really just ask that you share this knowledge with anyone who may need it amongst your networks. If there's anyone that you feel that we could support, please share our contact information. We can also pop it in the chat. We'd be happy to have any type of discovery call with anyone who might need these services. And I'm not sure, I was going to ask, do we have time for questions?
Yeah, we totally do. Thank you so much,
Great.
Kerri. Does anyone have any questions for
I
Kerri?
see Peter has one in the chat, but he could probably say it out loud.
Sure. Thanks very much, Kerri. Very exciting. It's great to see these types of simulation labs and environments give people a sense for what they should do when they see the real world. I think the real world we're seeing right now in Alberta is there's the massive amount of issues between ambulance, paramedics, doctors, nurses, teamwork, hospitals, and the economics of all of that. That is the real world we're living in today. Does your simulation think about that?
Yeah, it does for sure. That's a great question of how do we start to bring in that? We call it the system thinking, system simulation. So even when we're looking at, say, introducing a new protocol, we want to understand how that would work actually in a simulated environment before moving it to the clinical setting. So if we look at different types of efficiencies, protocols, even if you're introducing a new type of product into the real clinical world, will that save time? Will that save money? How will that interact with the human factors piece of it? So does it add a complexity with the health team, or does it add simplification? So those are all things that we want to test in simulation first to get some of that evidence, and that evidence will help kind of build that case to move forward either with that new protocol, new design, or improved efficiency as well. Does that answer your question?
Yep.
Awesome. Great.
Love hearing about the human factors for sure. And Alan has a question.
Great.
So how welcoming do you find, say, like Alberta as a because I'm assuming if it works out well, that's sort of do you call it a clinical trial?
We're not quite, we're just affirmative testing, so not quite at the clinical trial stage.
Okay, got it. So like how receptive is like AHS to being like open to hearing what you guys come up with, those kinds of things? Because what we always sort of hear out here is budget cut, and those kinds of things. So I just wonder how receptive, because I'm assuming they're kind of the next step, right?
Yeah, they could definitely be the next step. There are multiple providers, but really working with AHS to understand what evidence do they require when they're looking at those innovators. So working with the evidence impact team to really see what type of evidence is required. And of course, that's going to be on the innovators, but we can start building that into the simulation. So for example, if the SME knows that they're going to require a certain type of testing or certain type of evidence that would future state be required, we start building that in as part of the product testing objectives at the beginning. So it's really looking at it almost like a full circle. So what is going to be required at the latter stages? And we start those type of testings earlier on to build that evidence before you're going to that clinical trial piece.
Okay.
Yeah, great.
Do you allow SMEs to use the any video or photos in their promotional material or customer facing material?
Yeah, so that's one of the things that we work with as well. So if we have some SMEs that are coming in to do some product type testing, that earlier phase is that we do ask that question is, are you going to be using this for marketing purposes? And then we're able to kind of go along and maybe tailor or do that photo shoot at the end, because our AV system is always taken from above. So that's not always great if you want to use those as training videos. So we're able to really work with the SMEs to help do that. But we're also able to work towards that end of at the scaling phase. We know adoption in healthcare sometimes can be a bottleneck. So we can help build out some of those training materials for the end users, developed by end users, to help with that adoption piece as well.
That's exciting. And then also access to facilities, access to networks as well as understanding of, here's an SME who comes in with a great idea, but they may not know what levels of approval or entities that they need to have approved. So is that the kind of expertise you provide too?
Not necessarily within CAMS, but we're really working on building our network. So would that SME, do they need to be referred to Innovates Edmonton, Innovates Calgary? We really are focusing on the niche of providing that, formative product validation within simulation. So if, or it might be the U of A Health Innovation Hub. So really looking at being a part of the network so we can help direct as well and actually be part of that integrated system.
I was thinking more of medical certifications or whatever the professional requirements or standards or boards that need to approve perhaps a medical device or procedure.
Yeah, and that's a great question. And again, we would probably just help provide them to kind of the right appropriate organization for the required standards, depending on what type of device or technology that would be.
Which can be helpful even to know who they are.
Yes, yeah, a contact, a person. Great. Any other questions?
Sorry, I kind of arrived like a bit late to the meeting.
Okay.
Can you test like digital products as well, like an app or something like that? Or
yeah, you bet. So we can do user experience. We can provide the type of setting that would be required for the digital, as well as the streaming services. If we look at remote health and digital health, we can help providing those tests as well.
also, like there's another thing about kind of data storage as well. It's pretty complicated. It's not really straightforward. I couldn't really find anywhere like about HIPAA and stuff like that. It's kind of complicated. There's like certain apps that provide strictly that kind of advice. And it's like, what, $300 a month or something like that. So I was wondering, like, does your facility and program provide any assistance with like regulations and stuff with like data storage, data protection and stuff, like different regulations like that?
Yeah, that's a great question. We may be able to provide some of that. I would have to investigate it a little bit more. We could do a discovery call and look at, because there are other areas at NAIT. Obviously, we have the other different types of programming and centers as well. So we may be able to collaborate to look at it from the health side as well from the IT side, and we might be able to come up with something.
Yeah, I think that's like one of the big pain points of like developing software for like healthcare and stuff like that. Like there's like so many privacy and like certain locations that has to be like the data center has to be within the province or like not in the States and like not in like in certain parts of Canada too. So
servers,
yeah.
And
Yeah,
we are subject to that as well. Oh, sorry, go ahead.
If I could jump in there just for a second, just for your information, I'm sure you're aware, Richard. But yeah, right now, like the FDA is fully revising their guidelines for software as a medical device, and they provided a 2021 update, but that's ongoing, as well as ISO with Europe. They're updating as well right now, and Health Canada is a little behind on getting that. So whatever the recommendation regulations are today will likely be changing. So just for your information, I would look at FDA recommendations on that, especially on where data is stored will be different in Canada, but all the security levels and everything that are required for that with software as a medical device is being currently updated, as its regulators are a little behind on it. The innovators are way out ahead of where the regulators are at.
Yeah, it's terrible. It's so hard.
Yeah.
Great. Thank you for your question.
Awesome. I think we'll probably head into some breakout rooms. Thank you so much, Kerri. That was amazing. Thank you for being here and sharing your presentation with us. I appreciate it. We would love to have you and Ephraim stick around for the breakout rooms
Yes, you bet.
to chat with people. Yeah, so we'll go into the breakout rooms. Please feel free to chat more about what you learned today or introduce yourself to each other. This is where the magic happens. Please stick around for these. And yeah, we'll probably have time for a couple. So I will assign those to you now. All right, there we go. Enjoy. Hey, everyone. So I just want to say another big thank you to Kerri for being here, sharing your story. It was very cool to have you and hear what you're doing at CAMS. So thank you so much. Yeah, and I want to open the floor to community announcements. So if you have an announcement, please feel free to unmute, raise your hand, and of course, listen to the Leaders Innovators Big Idea podcast. A new episode drops every Tuesday. Listen at libby.ca. If you want to be a guest or host, please feel free to reach out to myself or to Al, and we'd love to have you as a guest or a host. And anyone can be a guest or host. We want to hear your stories. So yeah, feel free to reach out. And now the floor is open for anyone to share.
My announcement is I'm going to Original Joe's in Kensington, and I'll be there in 1 hour for about an hour and a half if anybody wants to come by and have a beer.
Well, that's
awesome.
pretty awesome.
Yeah.
If that's a standing offer, I think we can synchronize that. That's pretty nice.
Yeah. Shoeless Joe's in Kensington, just in case you're trying to find it. I'll be the guy with a cowboy hat and a grizzly bear beside me.
There'll be a lot of people there with the cowboy hat.
I was wondering, Pete, did you trade the bike for the bear? Is that what you're riding nowadays?
Yeah, just for challenges. Yeah.
Jason.
Hey, yeah, I just wanted to make a small announcement, interrupt you guys. This is my first time. Everybody's told me about Rainforest. I was in town 2 weeks ago, checking the market out, looking for a job. I've worked I've been an entrepreneur, I've worked in government, and I actually used to live in Kensington. So I'm really missing out on that beer. So thank you.
What are you looking for, Jason?
I'm looking for, I really like to be in contact with co-founders, founders, because I've been one. So I like helping out there, advising, mentoring, even judging. So I'm thinking maybe the accelerator space or somewhere, maybe corporate venture capital where I'm in that big organization, but I am in touch with entrepreneurs and some of those really nice ideas, refining value propositions, that kind of thing.
Awesome.
Really unique profile. Thank you.
Well, welcome, Jason. You're in the right place, I feel like. So thank you.
I'm loving it. I'm liking it. Thanks.
We're happy to have you. Are there any other announcements at all? Oh, James.
Thanks, Amber. Yeah, so One Piece IT, we're actually looking for a new network analyst. If anyone knows anyone looking for work or internship, send them my way. I will put my contact details in the chat.
You're talking like Cisco skills or networking, like back end management. What are you?
Entry level, mostly like someone to manage our tech support desk. Currently, we've reached this kind of capacity at our existing staff level. So looking to kind of groom someone into a role, anyone looking for entry level network management would be great.
Should call this little organization and we'll call One Piece IT. Kidding.
You may have met them. Yes.
I heard they're pretty easy to deal with. Yeah, absolutely. I will.
So nice. Excellent.
But thanks so much. So if anyone comes across anyone looking, absolutely send them my way. Please and thank you.
Just pulling your leg. Thanks.
I appreciate it, Pete.
And everyone, I did put the save the date for all for the 33rd annual Aztec Awards, which will be held on November 4th. Oops, it says 2020. That's a typo on my part. 2022. And it's a hybrid event. So come on. So with that, I'll turn it over to Amber to close.
Awesome. Yeah, lots of cool stuff happening. If there's any other events or any other announcements you have, please feel free to drop it in the Slack channel. You can send it to me as well, and I'll definitely share it. Also, I know like once you sign the social contract, you get access to the Slack channel. If anyone's having trouble getting that link, please feel free to contact me and I will be happy to set you up with that. But other than that, thank you everyone so much for coming. It's great to see everyone, great to connect, keep connecting, and we'll see you next week. Thank you again so much, Kerri, and thank you everyone.